Good evening, dear friends, dear students. I hope you had fun time during New Year and you celebrated in your family and everything is well with you today. As usual, we will continue our lecture course of human anatomy discipline, and today we will look at torso or trunk muscle. Please, as usual, my traditional question is how do you hear me? Is everything fine with the connection, with the internet connection? Please let me know as soon as possible. My friends, I am waiting your response about internet connection. Yes, okay, thank you, Ahmed. And as I said, thank you. As I said, we will talk around torso muscle. You see the fine picture. This is the all muscle you see here. This is the mostly muscle of the trunk. Another word is torso. Torso. It means the same. Trunk muscles and torso muscles. Torso muscle has the same meaning. And we will discuss four issues, issues will be up for a debate today. This is a muscle and fascia of the back, muscle of the chest. We will look at diaphragm, as it is a separated muscle between chest and abdomen. And then in the end, we will deal with a topic and subtopic or issue about abdominal muscles. Let's get started. And first of all, I'd like to introduce you the term or word, what mean torso. Torso, as you see, is a part of the body. You see two torso, female and female right, and left is a male torso. That is a plastinated torso, and when we talk about torso, we deal about this part of the body. That is a body without head, neck, and limbs. It means torso. And today we will all muscles, all trunk muscles will be on the table of today's lecture. Muscles of the trunk or trunk muscles have different aspects. First of all, I'd like to show you aesthetic aspect. Of course, when people has sport figure and sport trunk and a lot of muscles, it look attractive and beautiful. Male torso, of course, has more muscles around back, around chest and abdomen, and it is visible. So as I would say that there is no shine to open all clothes in the beach when you have good and strong muscles in your trunk. The second aspect is functional aspect. This is all muscles, all trunk muscles provide all kind of movements of the spinal column. And you see how this girl, Julie Günther, this is visible how she can flex his trunk, and of course this is the work of all trunk muscles. Mostly all trunk muscles support posture and plastics and form the wall of the chest and abdominal cavity. This is very important point. When we talking about walls, we mean that these muscles along with the bones of the chest help to protect all internal organ, and especially it is important for abdominal cavity, because abdominal cavity has no walls, bone walls from the anterior side, and the trunk abdominal muscles help to protect all internal organ in abdominal cavity. And another functional aspect is that all abdominal muscles help the internal organ to move. Not only abdominal muscles and chest or pectoral muscles help us to breathe. Abdominal muscles help us to move internal digestive product along the digital tract, and it is very important function. So it is not only moving; it is the functional aspect of the trunk muscles is in helping internal organ to work properly. Clinical aspect of trunk muscles is helping doctors. It is very important for doctors to evaluate all posture and see some kind of pathological statement like hypertrophy, hypertrophy, and normal development of the body. And almost every doctor has to evaluate the tone abdominal muscle during internal examination of patient, like you see here. Doctors make palpation of the abdominal and evaluate the tone or the construction of anterior abdominal wall. And clinical aspect as well is during different contraction of trunk muscles, you can see a symmetry, and this is a line, central line in vertebral column, and you see that is during the contraction and pathological statement like kyphosis or flat back, it is visible and it helps doctor to state right diagnosis. A couple of words about development of the trunk muscles. You see here the cross section of 4 weeks embryo, and this is four important sources of the embryonal sources. First is the ectoderm. Here you see ectoderm, and it is a gray color. And from ectoderm is neural tube is developed. And the second source is the somit, and you see here 3 parts of the somit: dermatome, myotome, and sclerotome. And dermatome is the part which go to the hypodermal tissue, but sclerotome is the part which will be in the future bones. But myotome, this is a source for all muscles in our body. You see also here the car tube. It is a primer digest intestinal tract here. Next is development of the myotome. You see how this part is enlargement. It is it grows and enlarged more and more in 5 weeks. Then in 6 weeks you see the 2 part of the myotome. That is dorsal. Here is dorsal, and this and here dorsal myotome, and ventral myotome. And this ventral myotome is developed more in the muscle of the trunk. Here the dorsal part is the back muscles, but here you see abdominal or chest muscles which are part of the ventral myotome. And here you see how ventral part of myotome transform in 2 group or 2 layers of abdominal muscles: external internal and intermediate. This is the development of trunk muscles. And next picture show us the different somites. We distinguish occipital somites. There is 5 somites in this region, cervical somites, but we will discuss today thorax somites and lumbar somites. That is the part which we find in the torso muscle. And you see here how all muscles group are developed in 8-week embryo. Here you see the back muscles here. This is the intrinsic back muscles and some of external or superficial muscles in the back region, and also all muscles in chest and abdominal cavity. Here you see torso muscle classification, and there are 2 groups of torso muscle. First group, this is number 1. This is the muscles located on the dorsal body part, and all of these muscles we call the name back muscles. But group number 2 is the muscles located on the ventral body part, and I hope you remember that one of first group is the muscles located on the dorsal. Алло. Так. Ну, если Игорь Ивановичу удобно, так мы подойдем. Почему же нет? Если можно попозже, но если нет, то 10:30. Если попозже ему... После 12 оптимально, да. Я могу и на 12, давайте подойду в 12, подожду, 12:20. Давай, хорошо, Венеслав, спасибо большое, спасибо. Хорошо, да, спасибо большое, все, договорились, спасибо, до свидания. Sorry, we are talking about 2 groups. First is the muscles were developed from the dorsal myotomes, and that is the back muscles. But second group is the muscles were developed from the ventral myotomes, and we see 3 groups. This is thoracic muscles, abdominal muscles, and diaphragm. Telling to diaphragm is a part of cervical myotome. It is not thoracic myotomes. It comes from the neck, so it is innervated by the nerve of cervical plexus. But for this period of time, it doesn't matter, because we will study innervation of the muscles next year, when we will talk about peripheral nervous system. But now the time is for muscle study. And the first group we will give consideration to the muscles, fascia and topographic formation of the back. This It's a dorsal part of our body. Here you see lines that serve as a borders of the back region. And you see the red line. The border between neck and back is going from the acromial process of the scapula here to the seventh vertebra, processus spinosus in the seventh vertebra, cervical vertebra. Then it is go right to the right acromial process in scapula. And the lower border go from the sacrum or sacrum. I hope you remember this bone. This is the dorsal part, and this line goes through the ossis ilium, that is the part of the pelvis bone. And this very large area, all of this area, we call back. And you see 6 back areas or regions. First, we call vertebrate area. It is here. This is the vertebrate area. Second area is suprascapular area. Then, in projection of scapula lies the scapular area. Under previous region, we could find subscapular area, and between sacrum and subscapular we could find lumbar area, and small area on the dorsal surface of the sacrum we call sacral area or sacral region. I'd like to take your attention to the fact that occipital region is here. Occipital region, it belongs to the neck region, but not to the back. Sometimes you could find the information about occipital region during when you study together with the back muscles, because some of the muscles come from the back and go to the neck, or sometimes even to the head. And so it may be that muscles are located mostly on the back, but the point of its origin or the point of the connection with the bones, with the skull bones, are located on the head. So don't be confused. Some of the muscles are located on the back, but you could see these muscles even on the occipital region, but sometimes even on the head. That is classification of back muscles, and as you see, there is 2 groups. First group of the back muscles we call superficial muscles. They are located superficially, and they mostly move upper limb or bones of the upper limbs, but sometimes it is also, they are also connected to the, they have origin to the ribs. And the second group is deep muscles, and we distinguish three layers: superficial layers, intermediate layers, and deep layers in the deep muscles. So as you see, we could find at least 4 layers. First layer is superficial muscles. The second layer is superficial layer of deep muscles, then intermediate layer, and the deepest layer is deep layer of deep muscles. Don't be confused. There are a lot of layers on the human back side. Another principle of classification. This is a classification by origin. And here you see the ventral origin muscles, and they are innervated by anterior branches of the spinal nerves. The second group, dorsal origin, has dorsal origin. Mostly this is all deep muscles. They innervated by the posterior branches. And small, only 2 muscles, but in the it is on the back. It is only 1 muscles we call trapezium, trapeze muscles, and it is have cranial origin, and it is developed from 5 branchial arch. That is a muscle we call trapezium. Here, trapezius. This is the muscles come from the cranial. And here I will show you all superficial back muscles. First of all, it is trapezius. This is big muscles located on the surface of the back, and even on the neck. It is, don't be confused, the border between neck and back is on this line, but superior part of the trapezius are located in the neck, but even in the head. The second is we call Musculus Latissimus dorsi, or Latissimus dorsi muscles. That is the Latissimus dorsi muscles. You see, it's here. It starts from the processus spinosus of the vertebral column, come together and have origin in the point of fixation in the humerus bone. So these muscles move up limb back in the dorsal direction, and it is also produce abduction of the upper limb. Next is the levator scapula. Here, that is a levator scapula. These muscles help to move the scapula up, and sometimes we call these muscles for the muscles of the bad students, because when people say, I don't know, sometimes students answer for the teacher. When teacher asks them something, they say, I don't know, and they usually move the scapula up with this levator scapula. So I think the students have students who study not very good, they have levator scapula quite strong. That is strong muscles for bad studying students. I'm joking. The next is the rhomboideus major and minor. This is the two muscles. Small is rhomboideus minor, but the large muscles here is the musculus rhomboideus major. This one. And two muscles which are connected with the ribs. This is the musculus serratus posterior and serratus inferior, posterior superior and posterior inferior. Here you see musculus serratus posterior. This is muscles come from the processus spinosus and fix on the ribs here. So usually these muscles pull ribs down and help us to produce expiration. Serratus posterior superior muscle make inspiration, but that is inspiration. But here is the expiration muscles because it moves ribs down. Deep muscles, deep group of back muscles, and superficial layer. That is two large muscles. They are located mostly on the neck. We call it Musculus Plenus Capitis. This is the Musculus Plenus Capitis. It is start from the cervical processus of spinosus processus of the cervical vertebra, but it is fixed in the occipital bone. So it pull the skull back and laterally sometimes. The second muscles located lower. It is also splenium muscles, but it is cervixes, musculus splenius cervixes here. And as you see, they are located mostly on the neck, but the part is also on the back region. The strongest muscles, the most interesting muscles in the superficial layer, that is we call musculus erector spina. All of these muscles, this is a strong muscles. This is a musculus erector spina. It has three parts. Laterally located musculus iliocostalis. This is one. Sorry, this one is musculus iliocostalis in Latin. Intermediate position has musculus longissimus, what means the longest muscles in the back, and medial position here is musculus spinalis, this one. So three muscles together form musculus erector spina. Intermediate layer, the third layer in the back region, we could find musculus transversus spinalis. This is a muscle start from the transversal process and fixed in the spinosus process. So this muscles has three portions. Superficial portion we call musculus semispinalis. Under this semispinalis muscles are located musculi multifidi. This is musculi multifidi, and small and shortest group are located in the deep. We called muscular rotatoris. Rotatoris means that function of this muscle to rotate our body to the contraversal side. So this is a three group of musculus, three part of musculus transversus spinalis, and you see that here. And deeper layer, this is small muscles located between spinosus processes, or sometimes between the transversal processes here. These muscles help to flex our vertebral column, and they are good visible in the cervical region and in the lumbar region, because this is a more free movable group of vertebral column. And musculus levatoris costarum, this is start from the transversal process and fix to the ribs, and this is a breathing muscle. They help us to inspirate air in the lung. Some of deep and short muscles we called nuchal muscles, located between head and two first vertebra, axis and atlant and axis. And this is a two group: obliquous muscles. This is obliquous inferior muscles, and this is also musculus obliquus capitis inferior in Latin. Here is the English name. And second obliquous muscles we call musculus obliquus capitis superior, or obliquus capitis superior muscle. And two rectus capitis muscles, rectus capitis minor and rectus capitis major. They are located very deep, right back to the joints between the first and second cervical vertebrae. There are two fascia, two layer of back fascia, and this is superficial fascia. It is located on the skin, so we sometimes call it subcutaneous fascia, and fascia propria, which is muscles, which is a fascia for all layers, for deep muscles. As you see, it has posterior layer, middle layer, and anterior layer. The deepest layer is the anterior, and it is covered of Musculus Quadratus Lumborum. This is the muscles of the abdominal region. You see here the fascia, and this is the propria, fascia propria, and some of three layers. Here is the superficial, then you see our posterior layer. This is the middle layer of the fascia, and here is the anterior layer. And this is the we call sac, or the spatial or space which is between bones and fascia, and it is contains the all deep muscles of the back. Here we call Musculus Erector Spina. This is Musculus Erector Spina. It is interesting to see the point or regio where a doctor, the surgeon, sometimes find hernia. This is the part of the abdominal organs come out from the gap between muscles, and this regio we call lumbar triangle. As you see, it is between the inferior border of Musculus latissimus dorsi, between the Musculus external oblique muscles, and between the pelvic bone. In this region we could find hernia. Here is hernia. In another part of the lumbar triangle, it's called lumbar space sometimes. And for doctors, it is important to know triangle where is not much, not very, not. It is the thin layer where muscles absent, and it is possible to hear the inspiration and expiration sound when people breathe, and it helps doctor to diagnose some of lung diseases. Next part of our lecture, that is the muscles and topographical formation of the chest. Let's see the chest borders. Here you see the line, the upper border of the chest. It is between neck and chest, and the lower or inferior border between abdomen and chest is it goes through this horizontal line through the xiphoid process. I hope you remember that xiphoid process is a part of the sternum or osternum. And you see all region here. This is the region, 6th region in the chest. Intraclavicular fossa, here it is under clavicular. This is the pectoral, presternal, axillar regions, and two lower regions, number 4, inframammary. It means that it is located under the mamma or mammary gland, and one is the lateral region in the lateral and inferior part of the chest. Here the chest muscle classification. You see that by topography, all chest muscles we could distinguish two groups. First group, that is the muscles are attached to the upper limbs. So these muscles help us to move in the humeral joints and they move our upper limb. But second group, this is the muscles are attached to the ribs, and they have a role in respiration. Sometimes in inspiration, some of the muscles help us to expirate air from our lung. When we see the origin of all chest muscles, it is visible that all chest muscles have ventral origin, and they are innervated by anterior branches of spinal nerves. First group, this is the muscles attaching to upper limb bones. The biggest one is the muscles we call pectoral major muscle. It has three parts: clavicular, sternocostal, and abdominal part. It starts from clavicular, sternal, or ribs, but come to the this point of humerus. We call it crista tuberculi majoris, in Latin. So usually the pectoral muscles help us to rotate humeral bone, to rotate in internal, or another term is to supinate upper limb, but it is also make abduction when the upper limb is in abduction position. This is move to the trunk, and this function is called adduction. Under pectoral major muscles, we could find a small pectoral minor, and usually it starts from the third, fourth, and fifth ribs, and attached to the coracoid process in scapula. So it helps to move scapula anteriorly, and it is also the muscle which is forms the anterior wall of axillary cavity here. Sorry, I forgot to show you another two muscle of superficial layer, or muscles attaching to the upper limb. This is a small subclavius muscles, and here you see some usually six part small sharp part of the serratus anterior muscles. It is visible on the lateral wall of the chest, especially in male, because they have stronger such muscles, and fix this. It starts from the ribs, but connect to the scapula and move scapula anterior. Chest muscles attached to the ribs. This is external and internal intercostal muscles. As you see, external located superficial, but internal located deeper. And they help us to breathe. External help us to make inspiration, but internal muscles help us to expirate the air. As well as the transversus thoracis muscles, that is some of the parts or strips of these muscles located in the internal surface of the chest, anterior chest wall. And also subcostal muscles. They pull ribs down and help people to expirate. So, in all of these muscles, only external intercostal muscles is inspiration muscles, but internal subcostal and transversus thoracis muscles, they are expiration muscles. They help people to expirate air. Fascia of the chest is difficult. You see you see also a superficial fascia and proper fascia or individual. 3 layers: superficial, deeper, and thorax. Here you see this is fascia superficial, and here you see 3 layers of propria fascia or individual: superficial, deep, and thorax fascia. But also because from the internal cavity, from the chest cavity, we could find also the third fascia of this region, and we call it endothoracic. It's not an abdominal, it is not right. It is endothoracic fascia. It is located in on the internal surface of the chest. There are 3 triangles in the pectoral region, or we call them chest triangles, between clavicula and superior border of the pectoral minor muscles. This is the trigonum clavipectorale in Latin. In projection of the pectoral minor muscles, we see trigonum pectorale, and trigonum, it means triangle in Latin, and also subpectoral triangle or trigonum subpectorale between the lower border of the pectoral major muscles and lower border of pectoral minor muscles. These triangles usually is part of topography anatomy and help surgeons to to see the structure come from the axillary cavity and help to to get better orientation in this region. Diaphragm. Diaphragm is the muscles located between chest and between abdominal cavity, and this all of muscles, all of group muscular fibers we called diaphragm. Sometimes another word is another name is musculus phrenicus. Phrenicus means the same, means that these muscles help us to produce inspiration, and this is the border between chest and between abdominal organs. As you see, diaphragm has the central tendon. It is a white part because there is no muscular fibers here, but also there is the если на лекции что-то хотела. Ну, вообще должны, да. Ну, да, до 5 часов, наверное, можно. Пока других указаний нет. У нас пока еще на второй курс на практике. Дальше будет видно. Ну, пока до 5, да. Хорошо. Ну, уже нет. Уже нет. Аня, у меня, Настя, у меня лекция. Не могу долго. Давай мы решим. Хорошо? Да. Итак, so, this is the muscular part of diaphragm here. You see, this is muscular fibers, but the central part, there is no muscular fibers, only tendon, and we call that central tendon. As you see, through diaphragm pass several organs pass through diaphragm. This is the vena. This is the esophagus here. This is the internal of digestive system, and here is the opening for aorta. It is the main artery in our body. We call aorta, and this is three opening or three aperture. And this is a French word, aperture. All of these are located in the posterior part of the diaphragm. This is the posterior part near to the vertebral column. And here you see the muscle bundles of the diaphragm, three parts of muscle bundles. The sternal part or pars sternalis, it is red. The biggest part, blue, is pars costalis because it fixed to the ribs. And in green, you see the lumbar part or pars lumbaris in Latin. And between parts of the diaphragm, there are some triangles. Here you see this is the weak points of diaphragm, and where no muscle fibers. And here is anterior triangles, and here is the posterior triangles. Here, this is, as I said, it is a weak point. And the main function of the diaphragm is a respiration. Usually it helps us to inspirate air in the lung. Next group is muscles and topographical formation of the abdomen. First of all, it is important to know the border of the abdomen. The upper border here is the horizontal line through the xiphoid process. As you remember, it is inferior border of the chest, but superior border of the abdominal area. And the inferior border is located on the lower part of the abdomen, and usually it is combined with the special ligament between pubic bone and between iliac bone, and we call it inguinal ligament. And some of the surface or border on the symphysis, pubic symphysis here. So this large area we called abdomen, human abdomen. This is all of this is human abdomen, but we divide three etages or three section or division of the human abdomen. Upper abdomen, between upper border and the subcostal plane, it is go through the 10th ribs, and another line or plane is supracrystal plane, subcostal plane, and supracrystal plane. So we distinguish upper abdomen, mid abdomen here, and lower abdomen areas in our. But with the mid-clavicular line, this is a line past clavicular in the centrum here, we distinguish 9 regions. Epigastric region, here, epigastric region, the left hypochondriac and right hypochondriac regions. Then in the centrum we could see umbilical regions, and lateral part is left lateral and right lateral region in the mid abdomen area. And finally, lower abdomen area has unpaired pubic region and right and left inguinal region. It is important to know projection of internal abdominal organ for all of these small region. For example, when we're talking about stomach disease, we remember that stomach is located usually something like this, and we palpate and touch and examine stomach in the epigastric region and left hypochondriac region. When we're talking about appendectomy, this is a small process of the colon, and sometimes it is inflamed, and the surgeon need to evacuate, to cut this small process. Usually this small organ located in the right inguinal region. So it is very important to know projection of all internal abdominal organs on the anterior abdominal wall and in the sum of abdominal region, as you see here. Classification of abdominal muscles. We distinguish anterolateral group, and this is muscles is maybe long muscles like here, or broad muscles here. I remember you that broad muscles have special tendon we call aponeurosis. All of broad muscles have aponeurosis. And posterior group of the abdominal muscles is only one, muscles located between 12 ribs and iliac crest. By origin, all of abdominal muscles are developed from ventral myotomes. So they are innervated by anterior branches of spinal nerves. What kind of muscles we could see, and I show you the superficial broad muscles. It is external oblique muscles. This is the first layer. Then under the external we could find internal oblique muscles or internal oblique, and you see aponeurosis. You could nicely see this spot, this aponeurosis of these muscles. And the third layer, the deepest layer, this is the Transversus abdominis muscles here. In Latin, Musculus transversus abdominis. Almost the same name, but another pronunciation. And you see that there are three layers. Here you see three layers of lateral abdominal muscles: external oblique, internal oblique, and transversus. They are located in the lateral area of the abdomen. But long muscles, it is musculus rectus abdominis, this one. It is big muscles between ribs and between pubic bone here, and it has intersection tendinous, that is the border between myotomes, between upper and lower myotomes in the abdominal region. As you see, rectus abdominis muscles located between aponeurosis of the lateral abdominal muscles. So this is internal layer and external layer, and between them located the rectus abdominis. Posterior group of abdominal muscles is only one muscles called Quadratus Lumborum. Here, as you see, it is between 12 ribs and iliac crest, iliac bone. Abdominal fascia. As always, we could find superficial fascia. It lies under skin, and individual fascia has three layers: superficial, intermediate, and deep. And the third fascia here, as well as in the chest region, called endo-abdominal fascia. It is located. This is the deepest fascia, which is it covers the internal surface of all abdominal muscles. Some of topographical structure here. The very important topographical structure called Canalis inguinalis, or inguinal canal. That is slot small space between the abdominal lateral muscles, and usually it is located above the medial and middle parts of the inguinal ligament. Inguinal canal contains in man spermatic cord. This is the spermatic cord, which provide connection between testis and prostata, and that is the way where spermatocyte or spermies come to the prostate. And for women, this is for women. Here is a woman. Inguinal canal, and it is located around ligament of the uterus. So this is the difference, and you can guess that the size of men and women inguinal canal different. Men have large canal inguinalis. When we talk about canal inguinalis, we take in consideration that this is a weak point of the abdominal wall, and especially for men. So we ask you to know the walls of the abdominal canal. It has anterior wall, inferior wall, superior wall, and inferior and internal wall. So there are 4 walls of inguinal canal, and usually talking about weak points of the abdominal area, we consider that there is linea alba. This is the central connection of all aponeurosis of lateral group abdominal muscles, and I will show you here. This is the linea alba, it means in Latin a white line. Linea alba means in Latin white line, because there is no vessels, no arteries, no vein in this area, and it is easy to cut the anterior wall, and it is no chance to cut vessels, because all vessels come from the lateral side, and on the central part in the linea alba there is no vessels. But after surgical operation, it would be the weak points where linea alba is weak, especially in the upper part. This central point of abdominal area is a point where umbilicus from the fetus come into the fetus body, and we call it umbilicus. It is also weak point of the abdominal area. So there are three weak points of abdominal area. This is one is canal, inguinal canal. The second is the linea alba, and the third is the umbilicus. This is usually a point where all hernia are located, and surgeon have to know all of this point. And this is a picture of Igor Belkovsky. This is a body. I'd like to show you how beautiful is human, especially in women. Thank you for your attention, and I'd like to ask you about questions. If you have questions, please let me know. This is time for getting your questions. Please, my friends, put in the text box your questions. When we are waiting for your questions, I'd like to tell you that there is a special test today. A test about torso muscles, and it will be open till tomorrow, so you have enough time to pass this test, and check yourself about knowledges of trunk muscles. So I see no questions. Then let me, I'd like to say you goodbye and wish everything best in this week, and hope to see you next Monday in our anatomical lecture course. Thank you very much, and goodbye.